Answering your coronavirus-related questions. The #1 question today, did you get your stimulus check? The IRS said more than 80 million Americans should see their payment deposited into their bank accounts. But what if yours didn't come yet? Lindsay Nadrich has the answer.
The tool to track your payment wasn't expected to be up and running until Friday, but it launched today on the IRS website. Go to irs.gov and click Get My Payment. This will let you check the status of your payment and whether the IRS needs more information from you. Click Get My Payment again, and it will take you to this page where you have to hit OK. It will then ask for your social security number, date of birth, and address. Enter all your info and hit Continue. The next page will tell you the status of your payment. In my case, I received it via direct deposit today. I've heard from others, though, who haven't received their payment yet. One person saw this page that said payment status not available. Another person told me the app said they're eligible for a payment, but it didn't tell them what day they'll get it. The IRS said the site is updated once daily, usually overnight. And because so many people are using it, they're asking everyone to only check it once a day. I'm still waiting to hear back about what you should do if you think your payment amount is wrong.
Okay, so let's say you have your check. Many of you are still wondering if you have to pay taxes on it or if you have to pay it back. Our Verify team has the answer to both of those questions.
No. The CARES Act made this money available as a federal income tax refund, and the IRS shows that refunds aren't taxable. So no, you don't have to pay taxes on these stimulus checks. The next biggest question, will I have to pay this money back? There is a bit of confusing language around all of this, but the short answer is no. The CARES Act calls this an advance refund of a credit that they're giving you on your 2020 taxes. So essentially, Congress is giving you a tax break next year and sending you that money right now. Since it is a tax credit, you won't have to pay it back. The money is yours to keep and use. And if you normally get a refund or owe taxes at the end of the year, this credit actually won't affect your normal taxes at all.
And there is a lot of talk about reopening the economy and easing stay-at-home orders. But is it really safe to go out to do that yet? Or would we be putting ourselves at risk for an increase in outbreaks? I caught up with Dr. Kavita Patel from the Brookings Institution to get some answers. Dr. Patel, there's a lot of talk about reopening the country. I mean, do you think we're at a point where it's safe to start doing so, without jeopardizing the progress we've already made?
I do not think it's safe to reopen the country anytime soon. And let me be more specific. We know that even in places like New York and Seattle, where we're seeing a decrease in what we call the doubling rate, the numbers of cases, we know that this is the time where we have to double down and continue aggressive stay-at-home or isolation or social distancing measures so that we don't have a rebound spike. And remember, the rest of the country, depends on all of us doing the same thing. So even though all of us, including myself, are frustrated, we still need to remember that this is a deadly virus and that we have to keep measures to stay in place and likely extend them into the end of May or early June, to be honest.
So when people talk about, easing back into things, you don't really see that happening.
I see easing back into things in two formats. In May, I think there are going to be certain businesses that we can talk about whether they're able to have shortened hours that could be open that serve a function. For example, services that support other essential businesses or healthcare workers, for example. But I do think that as far as most Americans, staying at home and social distancing will continue to be in place. However, all of us who are in healthcare or in full government or leadership, we need to also plan for what does happen when we open up, and that means having testing, tracing, isolation, and some of the other things that we need to do ready to go from day one. And we're not ready today. So today, stay at home, continue to do that, likely through at least the middle of May, if not the end of May, and then focus on the summer months in waves of reopening bit by bit.
And when you talk about those waves, what kinds of businesses, when you say, supporting healthcare workers, what kinds of businesses would those be?
Yeah, I think that there's a lot of, for example, right around hospitals or clinics, we know that there are essential services for essential workers. That could be anything from restaurants. Certainly, restaurants have been doing kind of curbside deliveries, but a lot of restaurants have closed, as you know. Other services that have been supportive, which have had to either shut their doors down or dramatically decrease their business hours in the daytime, such as smaller companies which provide support for hospitals, not around labs or things like that, but there are a number of companies that have also had to shut down because of their own workers. Labs, for example, have actually had to close. If they're not doing COVID testing, they've had to essentially shut down. So we have a bit of a backlog in aspects of the business of taking care of people that we've had. And I think that's a good example of things that can open up. I also think some education services, not schools where we're sending kids, 30 kids at a time, but there have been parts of education and daycare and childcare where we're going to need to reopen aspects of them in order to support workers going back into the workforce. And that's a good place to start in order to open up the economy.
At any time, you can text us your questions. The number's on your screen, 503-226-5111. Now, if we don't get to your question tonight, we'll be answering questions right here at 7 o'clock, Monday through Thursday. And still ahead tonight, testing for the coronavirus. You wanted to know how the tests work and why an antibody test is so important. We'll have the answers. But first, today would normally be tax day, but it isn't. You wanted to know when the Portland arts tax is due. The answer, just like federal and state taxes, the deadline has been extended to July 15th.
Reconnect in your backyard with Spa Logic Hot Tubs. SpaLogicHotTubs.com.
A safe and reliable vehicle is crucial, which is why Beaverton Toyota remains open amidst the COVID-19 crisis. As an essential service provider, it is our responsibility to be here for you when you need us the most. We've taken every possible precaution to guarantee a clean and safe dealership and adjusted business operations to minimize physical contact and time spent. You should be confident that your vehicle can get you to the grocery store and beyond. Go to our website or simply give us a call. Beaverton Toyota is here for you.
From our family to yours, we want to encourage you to keep going. Keep protecting what's most important. Keep hopeful in the face of all this. Keep believing. Keep being strong. Keep supporting the people on the front line. Keep staying together while staying apart. Keep being fearless. And most of all, keep dreaming. If you have any concerns about your policy coverage or about making payments, please call us. We'll keep being here when you need us.
We're all spending a little more time at home these days and taking care of our community and the people we love. Those are the things that Terra Firma Foundation Systems knows best. During your time at home, if you notice signs of structural or foundation issues, we want you to know our local crews are continuing to work to keep you and your home strong and healthy. If you have questions about our services, please call or visit our website, Terra Firma Foundation Systems, making your home a safe, solid, better place to be.
When we first opened our doors, it didn't take us long to realize
we weren't in the car business.
At Lexus, we were in the people business.
We needed to be helpful,
respectful,
and compassionate.
To treat people like guests.
It's what we all signed up for.
And now when people need this most, we will do what we've always done.
Take care of people first.
The rest will follow.
Curbside pickup, the new phenomenon. How to get the stuff you buy safely and quickly during the pandemic. Tips on mastering curbside pickup. Next, Inside Edition.
Tonight at 7:30 on KGW.
This week on KGW News at Sunrise, we're focusing on you and your relationships. Talking about creative ideas for date nights at home and having tough conversations without a fight. Couples get expert advice on getting closer during this crisis.
Welcome back. There are still so many questions around testing for the coronavirus, but what are the tests that need to happen and why are they so important? Well, there are two types of tests, and here's what both do.
In the midst of a pandemic, a virus too small to see has changed our lives in ways once too big to fathom. Yet if we are to get back to life as we once knew it, a viral game of hide-and-seek must end. Which brings us to the scientific equivalent of turning on a light, or in this case, a test, two of them. First one is one you likely know well, although probably not by its name. PCR, or polymerase chain reaction testing. It starts like this. Oof. Once collected, the cells on the end of that swab head to a lab where lab techs attempt to turn RNA into DNA with the help of enzymes. Don't worry, there won't be a test on that. Just know if you had the virus, odds are the PCR test will find it. But what about those who had it? Scientists call the second test a serological test. We'll call it an antibody test. Why? Because the test actively looks for antibodies in the blood. Antibodies produced to fight off disease. If you had the novel coronavirus, even if you didn't know it, you will have antibodies, and those antibodies provide a level of immunity. It's thought at least 1 in 5 infected with the virus don't show symptoms, but anyone with antibodies could go back to work, back to school, back to ERs or ORs without fear of infection. The more we test, the more we'll know what a virus too small to see has been up to. Millions of tests might be necessary, each to help us seek not just where the virus hides, but where it's hidden. The sooner we know that, the better the odds of us putting an end to this deadly game.
You know, one question we get a lot from viewers, they ask, if I get the coronavirus and recover from it, will I be at risk of catching it again? NBC medical contributor Dr. John Fair has some answers for that.
At least according to the laboratory studies in the rhesus macaques, and I think, very largely anecdotally, the answer is that you are not at risk from getting COVID-19 again, at least immediately. Again, you'll go back to, we have no idea how long that immunity will last. But you can have a pretty high degree of confidence, at least according to the laboratory, and if humans are indeed following the monkey model, then you can have a high degree of confidence that you have some immunity to the virus, at least for some period of time. How long, we have no idea.
And still ahead, you've heard Governor Brown talk about contact tracing. But what is it and how does it work? We'll have the answers. But first, some are still asking about the symptoms of COVID-19. The most common symptoms are fever, cough, shortness of breath, but many other symptoms have now been reported, including aches and pains, nasal congestion, sore throat, and diarrhea.
Got this.
We're standing strong,
holding the line together.
Bust another move, get on down. Bust another move, get on down. Bust another move, get on down. Bust another move, get on down, down. Watch me groove, I move, I get so loose, I lose my cool. Watch me groove, I move, I get so loose, I lose my cool. Kick off my shoes, get in the mood, get on down. Bust another move, get on down. Bust another move, get on down.
One of the hardest things about that day was telling the children that Mom had cancer and to try to help them understand that it was going to be okay when I didn't believe I was going to be okay. I've learned through Dr. Stanley that you cannot be full of fear and full of faith at the same time. Every time he says something, I'm like, oh, wow, I see it. And I get excited because I learned something different.
And here we have another burst pipe in Denmark. If you look close...
Jamie, are there any interesting photos from your trip?
Ouch. Okay. Boring. Boring. You don't need to see that. Oh, here we go. Can you believe my client Stieg had never heard of a home and auto bundle or the renter's good bundle?
Wait, you're a lawyer?
Only licensed in Stockholm.
What is happening?
Anyway. Game show, Kumite, Cinderella story.
You know karate?
No, Alan. I practice Muay Thai. Completely different skill set.
Coming together makes us stronger, and Ford is built to lend a hand. Contact your Ford dealer, an essential part of your community, to find out more about home delivery and other vehicle service options. After all, you have a lot to take care of. Let us help take care of you. Find out more at Ford.com. Right now, get 0% APR for 84 months and don't make a single payment for the first 3 months on select Ford models. Only at your local Northwest Ford dealer.
In the Army National Guard, family means everything.
Our parents, they were really supportive that all 5 of us would join. I got my education because of the Guard. I got to travel a little bit and experience a whole different culture. It helped me get my job, helped me pay for my house. Being part-time really helped because I could have some opportunities that were still in education.
Serving part-time in the Army National Guard instills pride that you and your family will share. Visit NationalGuard.com to learn more about part-time service.
Many health officials believe the best way to battle the coronavirus pandemic is contact tracing. But what is it and how does it work? Let's connect the dots. Contact tracing is a tool used by infectious disease specialists for decades. Basically, when they find someone with an infectious disease, they perform a thorough interview to find every person they may have had contact with during the time they were contagious. They then contact those people either for testing or to order a quarantine. It often requires a lot of time and manpower. But this new approach to contact tracing sounds a lot simpler. With help from Apple and Google, your own phone could find everyone you were in contact with. Using your phone's Bluetooth, it can determine whose phone you were near while contagious. People with the virus would need to download an app for those contacts to be notified, but you don't need the app yourself to get the alert. There are privacy concerns. Google and Apple had said no names would be attached to the data they have, but experts worry this is a slippery slope, and this kind of tracking could stick around long after the pandemic is over.
Have you seen advice on social media saying that you should swap your contacts out for glasses in order to lower your risk of catching the virus? Well, our Verify team finds out if that's really true.
Today we're talking about eye care. Lots of people are sharing this advice. If you wear contacts, swap them out for glasses to avoid touching your eyes. So let's verify. Is there any evidence that wearing contacts puts you at a greater risk during the pandemic? Here are sources: the Centers for Disease Control and Prevention, the American Academy of Ophthalmology, and Dr. Lyndon Jones, the director of the Center for Ocular Research and Education at the University of Waterloo, who published a new peer-reviewed paper on this exact subject. All our experts agree. There's just no evidence out there showing that wearing contacts rather than glasses puts you at a greater risk.
When we look at patients who are contact lens wearers, and we look at the evidence around whether they're more likely to develop COVID-19 versus spectacle wearers, there is no evidence to support that whatsoever.
So that's verified. But not all our experts agree on what that means contact wearers should do. A clinical spokesperson for the American Academy of Ophthalmology says they're erring on the side of caution, suggesting that patients consider taking a break from contact lenses for a while. But the CDC sided with Jones, saying that people who are healthy can continue wearing contacts so long as you practice good hygiene. Dr. Jones says if you're feeling sick, that's when it's time to throw on the glasses.
All right, here's a question we've gotten since the beginning of all of this. Is the coronavirus mutating, and why is that important? Dr. Ken Stedman, a biology professor at Portland State University, has the answer.
Now, we're really worried about mutation that's happening with the virus. Well, all viruses mutate, and they mutate with a relatively slow rate, and it turns out that now we have quite a lot of data with this particular coronavirus, and it looks like mutation rate's actually very low compared to things like flu. And so this is actually really good news, because it means that whatever vaccine we come up with, or people who become resistant because they've been infected before, they are highly likely to be protected because there has not been very much mutation in the virus genome over the period of time that's been developing, even from the very first days and the first sequences we got from Wuhan. And I think that's really sort of the main thing, other than the, it looks like we started out here, stay home, stay safe, at least in Oregon and probably in Washington and California seems to be working. And so I would say let's keep up our physical distancing, still do as much social contact as we can have, just make it sure it's physically far enough apart.
And still ahead, where you can get answers to your unemployment question, even though the phone lines have been busy. But first, you wanted to know, is it safe to still go fishing? The answer, the Oregon Health Authority says it is safe if you are healthy and maintain 6 feet of space, at least 6 feet of space between you and others at the boat ramps or docks.
Your news when you want it. Follow KGW on Instagram.
A safe and reliable vehicle is crucial, which is why Beaverton Toyota remains open amidst the COVID-19 crisis. As an essential service provider, it is our responsibility to be here for you when you need us the most. We've taken every possible precaution to guarantee a clean and safe dealership and adjusted business operations to minimize physical contact and time spent. You should be confident that your vehicle can get you to the grocery store and beyond. Go to our website or simply give us a call. Beaverton Toyota is here for you.
When we face adversity, we find a way through it. It's about taking care of each other. It's the small parts that make a big difference. At Chevy, we promise to do ours. We're offering current Chevy owners OnStar Crisis Assist services and complimentary Wi-Fi data. If you need a new Chevy, interest-free financing for 84 months with deferred payments for 120 days on many of our most popular models. You may even shop online and take delivery at home where available. It's just our way of doing our part.
Right now, it feels like the world's standing still. But if you look to the land, it's a whole different story. From farms to backyards, wheels are turning, seeds are being planted, animals are getting fed, grass is growing, and families are giving their all to the soil. Because no matter how uncertain things get, the land never stops. So to all those linked to the land, we say thank you. We're here for you because we all run together.
Small businesses are at the heart of our community.
Right now, they need a little help. Let's come together and give them that help.
Yes, we're open.
If you're a small business that is open during this time, send us a 10-second commercial.
KGW is going to help spread the word. Yes, we're open.
Yes, we're open. Small business owners, go to kgw.com/open and sign up today.
Providence caregivers are working day and night, risking their lives to save the lives of others. But we are in this together. And so many in our community have stepped up to help with donations, with encouragement, with love. You can support caregivers on the front lines. You can speed research efforts. You can help. And if you need us, we'll be here. Give today at providencefoundations.org/COVID-19.
Curbside pickup, the new phenomenon. How to get the stuff you buy safely and quickly during the pandemic. Tips on mastering curbside pickup. Next, Inside Edition.
Tonight at 7:30 on KGW.
Climate change. Romantic frauds. Just some of the topics I tackle on my new podcast, Under the Big Umbrella with Matt Savino. Short episodes, surprising topics. Subscribe and listen wherever you find podcasts.
Welcome back. We know you have a lot of questions about your unemployment filing with the state of Oregon. The online systems had a lot of glitches. The phone lines are jammed. Tim Gordon has some information on where you can get answers.
Well, we're reporting today about a lot of the problems that the online filing system's been having in the state of Oregon. It's an outdated system. You've been getting error messages or been getting messages that your claim's not been going through, and you're trying to call and not getting through on the phone either. Well, the department's website has a COVID-19 page, and it's pretty helpful. There you will learn about a lot of the cases, how your claim is maybe okay despite the messages you've received online. You can also learn about fixes they put in place to some of the problems, and there are also how-to videos to help you get through it all. Here's the Employment Department's Gail Krummenauer with more about the COVID-19 page on their website.
We want everyone to be successful filing online if we can. We want everybody to have a successful experience, especially in a stressful time like this. And we're trying to do everything that we can to provide all the additional resources in one central place for when that doesn't necessarily happen the first time. The large majority of claims that are going through successfully, and they continue to do so.
So some hope there. And it's also important to note that pre-COVID-19, from initial filing to getting your first payment, the average time about 3 weeks. And they say they're still running within that time frame today. So be patient, hang in there, and good luck, everybody.
Are worries about the coronavirus keeping you up at night or messing with your sleep patterns? Well, Damon Fernandez talked to doctors to get some answers on how to get a better night's sleep.
The most common cause of sleep disorders is anxiety and stress.
The doctors say among some of the factors impacting sleep problems include losing our normal daily routines.
Make your day as scheduled as possible, going from one task to the other.
They suggest exercising a few hours before hitting the sack.
Exercise actually burns up those compounds that get developed in our body when we don't sleep well.
And if you're stuck indoors all day, try opening up those blinds.
Expose yourself to light. Light is really very important. It's a very important signal to the brain to know when is wake time.
Doctors Elfecki and Winters say avoid heavy meals, alcohol, and caffeine before going to bed, but that's not all.
Don't work in bed.
Also try going to sleep the same time every night.
The hour or so before, you want to do things that let you unwind. Soft music, some light fiction reading perhaps.
And some good tips. Thank you for joining us tonight. KGW is committed to continuing our coverage on the coronavirus outbreak. And starting tomorrow, we're doing a weekly web Q&A hosted by Galen Etlin. This week, he's talking about navigating unemployment, and you can watch tomorrow at 7. We'll also be answering some of your unemployment questions. You can tune in to the web chat on any of our social media pages. And if you still have questions, our past stories may answer them for you. You can go straight to kgw.com/answers to see all of our past stories.
Homeowners experiencing the frustrations of low water pressure in the shower where you can't even